Hi, my name is Gwynnie and this is my daily patient reassessment video. So before entering the patient's room, I would check the electronic health record for any lab values, new orders or needed orders. And then I would also check the door for any flags or warnings that I need to know before entering the patient's room. So now we can get started. Hi, my name is Gwynnie. I'm going to be your nurse today. Can you please confirm your name and date of birth for me?
Morgan Takla, 10/27/05.
Perfect. And then I would just double check that with the wristband. What brings you in today, Morgan?
I just have like some pain in my shoulder.
Okay, pain in your shoulder. Is there anything that makes this pain like better or worse?
When I like raise my arm up,
Makes it worse. Okay. And anything makes it better?
Just relax.
Okay. And then, how would you describe this pain? Is it achy? Is it throbbing? Is it a sharp pain?
It's just achy.
Okay. And then does the pain stay in one spot or does it kind of spread everywhere? Or is it
just kind of up in my shoulder? Yeah.
Okay, just up in the shoulder. And then how would you rate your pain on a scale from 1 to 10?
Probably like a 4.
A 4. Okay. And then when did this pain start?
Yesterday I fell.
Yesterday you fell. Okay. And then has it been the same since then?
Yeah.
Kind of constantly hurting. Okay. Well, we will definitely do what we can to make that better. Can you tell me my name?
Gwynnie.
And where are we?
We're at UMary.
Perfect. And what day of the week is it?
It is Monday.
Okay. And then can you smile for me? Perfect. And do you have any difficulty swallowing at all?
No.
No? Okay. So the patient is alert and oriented to person, place, and time. They have equal face symmetry and there's no difficulty swallowing. The patient is responding appropriately to my questions asked and is clearly speaking and has good hearing because they can respond appropriately. Okay, so now I'm going to test your muscle strength. So can you squeeze my fingers? Perfect. And then pull towards yourself and towards me. And then can you push your feet down and up? And then lift your legs up. Perfect. Okay. So muscle strength is good. If the patient was not alert and oriented, then we would do the Glasgow Coma Scale, but they are doing good. Can you wiggle your toes and fingers? And are you feeling any numbness or tingling at all?
No.
No? Okay. That is good. So now we are going to move on to vitals. So I'm going to start by taking your temporal temperature. We're going to go across the forehead and behind the ear. Okay, and it's 96. That's good. Now we're going to do your pulse oximetry just to check for oxygen saturation. And while we're waiting for that, I'm going to check your pupils. So the size is, here we go. It's about 4 millimeters, and I'm going to just stay looking at me. Good. Good. Okay. Pupillary response was direct and consensual, and your pulse ox is a 98, so that is good. So now that we did that, I'm going to go ahead and listen to your apical pulse. So I'm going to go ahead and lean this back a little bit. Perfect. We're going to come over to this side. I'm going to lift this up. And you just let me know if you're uncomfortable. I'm going to listen for about a minute.
Okay.
Perfect. I counted your apical pulse at 78, regular, and then your respirations were 14, and those were also unlabored. So perfect. I'm gonna have you sit up and hang your legs off the bed here. And we're gonna do, first I'm gonna estimate your systolic blood pressure. Do you have any abnormalities with your blood pressure at all?
Not that I know
Okay, and is that comfortable?
Yep.
Perfect. We'll find your brachial pulse here. All right, and I'm gonna have you uncross your legs as well. Okay. Felt it at about 130, so we're just gonna inflate it 20 higher. Release that to about 150. Right. You comfortable?
Mm-hmm.
Okay. Perfect. I got 120 over 80, so great, within range. And that is all for vitals. So we're gonna go ahead and move on to respiratory. First, I would be checking for any nasal cannula or breathing machines to make sure that they are properly fitted, and the patient check the flow rate and the type, make sure that everything is normal. Do you experience any cough at all?
I do not.
No. If the patient was experiencing a cough, I would ask about frequency and if they're coughing up any mucus, just to make sure that everything is okay there. Next, we're going to go ahead and listen to your lung sounds. We're going to do 6 spots on the front and 6 on the back. Just take deep breaths for me, and if you feel lightheaded at all, just tell me and we can stop. Okay, come to the side here. The other side. All right, now we're going to come around to the back here. Slip that. Perfect. Your lungs sound very good and clear. If there was any adventitious sounds that I needed to be concerned about, then I would alert the doctor. And if there was any deep breathing, I would teach about deep breathing, and if there was an incentive spirometer ordered, I would make sure the patient knows how to do that as well. So next we are going to move on to cardiovascular. I'm going to start by listening to your 5 main points with the diaphragm and the bell of my stethoscope. Starting with the aortic. Good. Pulmonic. All right, Herb's point. Move this a little bit to listen to the tricuspid. Good, and then mitral. Good, now we're gonna switch over to the bow. Listen to all the 5 points again, starting with the aortic. Pulmonic. Herb's point. Tricuspid. Good, mitral. Okay, perfect. I heard S1 at the apex of the heart and S2 at the base. Everything sounded good. Now I'm going to check your capillary refill, and all should be less than 3 seconds. Very good. Okay, now we're going to do the toes. Again, should be less than 3 seconds. And then while I'm down here, I'm going to check for any edema. So starting with the legs and then the ankles. Perfect. And then foot. I'm not seeing any, and while I'm down here, I'm gonna check your pulses as well. So starting with the posterior tibialis. I can feel that, good. 2+. Then top of the foot. Good. And then your radial. Just gonna move this a little bit. Good, I can feel all the pulses equally, 2+. They are very good and normal. Next, I would check if there's any IV flow rate. If you had an IV, I would check the rate and the flow. And if you had any SCDs or TED-HOs, I would check those as well for like to make sure you're not getting any DVTs. So that is everything for your heart, and then we're going to move on to the skin assessment. I'm just going to check your temperature, and it feels warm bilaterally. If there was any, I'm not seeing any lesions or anything, again, just a little bit of sunburn here, but if there was anything that I would be concerned about, I would assess using the Braden scale for skin breakdown so that we can prevent that and limit that. Going along with skin, I would, if there was an air bed, if you were on bed rest, I would make sure that you have proper bed. If there was like a air pressurized bed or like things like that, I would make sure that they're on and working. And if you were also on bed rest, I would implement a turning schedule if needed. I'm going to check your capillary, or not capillary refill. I'm going to check for I'm going to do skin turgor, and I'm not seeing any tenting, so she is nice and hydrated. And now we can move on to your abdomen. So I'm going to have you lay down again. Put this a bit more down. And then just upon general inspection, I'm not seeing the overall contour is flat, and I'm not seeing any incisions or scars. Everything looks good. I'm not seeing any ostomies or anything. So we're gonna go ahead and start with auscultation, starting in the right lower quadrant, just making sure bowel sounds are present in all 4 quadrants. You just let me know if you're uncomfortable, okay? Okay, perfect. I heard bowel sounds in all 4 quadrants. Bowel sounds are normal active. I'm gonna do some light palpitations just to check for any masses or hardness or tenderness or any distension. So you let me know if you're feeling uncomfortable at all or if you're experiencing any pain. Okay. Starting in the right lower quadrant again here. You doing good?
Yeah.
Okay, I'm not noting any tenderness or masses, so that is good. And then you can go ahead and sit up. Are you experiencing any nausea at all? No? Okay. And then how is your diet?
I'd say it's pretty healthy.
Pretty healthy?
Fruits, vegetables, carbs.
Okay. And then if there was anything wrong with the diet, then we would make changes or any advancements if she was on a certain diet. How often are your bowel movements?
Probably once a day.
Once a day? Okay. And how would you grade them on using the scale?
Probably like a 3 or a 4 most times.
Okay, that is good and normal. Moving on, how often do you urinate?
Probably 5-6 times a day.
Okay, and then what is the color like?
It's like a pale yellow.
Pale yellow, and is it clear or cloudy at all?
Clear.
Clear, good. And do you experience any pain when you urinate or any smell or odor or anything? No? Okay, good. If the patient was having trouble urinating, then I would do a bladder scan to check for any urinary retention. And if there was a catheter or a Foley bag, I would make sure to empty that or clean up anything that sort. And then how would you say your movement day to day? Do you need any assistive devices or anything like that?
No.
No, you can walk pretty good?
Yeah.
Okay. We'd check for those. And then that is the end of my assessment. So I would make sure that the bed is locked. You have your call light. The head is at a comfortable position. Do you have any questions for me?
No.
Or do you need anything? No? Okay. Thank you for your cooperation today, Morgan.
Yes, have a good day.
Yes, you too.